there's a lot of frustration, a lot of confusion, frankly, out there among conservative groups and even among members, is reconciliation has certain limits. So there are folks who would love to see us put in this reconciliation bill all these other ideas. One conservative group is saying, by golly, you better put shopping across state lines in this bill or else we're not going to support it. If we did that, we wouldn't be able to pass this bill. It would be filibustered in the Senate. It wouldn't even come up for a vote.
That is Paul Ryan walking the press, the country, and perhaps members of his own caucus through the House plan on health care. Welcome back to Morning Joe. Mark Halperin, John Howman, Donnie Deutsch, all back with us. And joining us now, the Secretary of the U.S. Department of Health and Human Services, Dr. Tom Price. Mr. Secretary, good to see you this morning. Thanks for being with us.
Good to be with you again. Thanks so much. Happy Friday.
Happy Friday to you. One of the first questions we've been getting from people across the country, not people in Washington and New York, but across the country as they start to hear the details of the House plan unfold is, do I lose my health care on this? And that's a question a lot of people want answered. So the Brookings Institution, for example, came out yesterday and said they estimate about 15 million people initially would be moved off of health care. What's the number you have, Dr. Price, about how many people would lose their health care under this new plan?
Well, we don't want anybody to lose their health coverage or their health care. The fact of the matter is, right now, people are losing their health care and their health coverage because of the plan that was put in place by the previous administration. You've got deductibles that are increasing significantly. You got premiums. You got one-third of the one-third of the counties in the country that only have one insurer offering coverage. 5 states only have one insurer. That's not a choice for folks. So people are losing their coverage right now, and that's an important point because that's the baseline that we're looking at. What we want to do is to solve that, is to fix that, is to put in place a system that makes certain that every single American has access to health coverage of the highest quality, that's affordable, and that provides them choices. So we don't believe that individuals will lose coverage at all so long as they're able to select the kind of plan that they want for themselves and for their family.
So just to be clear, Mr. Secretary, initially, if this plan were signed into law, no one would lose their health care?
Well, nothing changes for 2017, as you know, in terms of the law that's being debated right now in
But when
Congress.
it's implemented, would anyone lose his or her health care?
Well, they may be moved from a plan that they currently have to a plan that's much more desirable for them to have. The thing that the previous administration did is to force people to buy health coverage that they may not want or can't use because of the increased premiums and the increased deductibles. So what we want and what we desire, and what the American people frankly desire, is a system that allows them to choose the kind of coverage that they have for themselves and for their family. And that's why we need the 3 different parts, 3 different phases. The bill that's in Congress right now, the kind of opportunity that we have here at the Department of Health and Human Services through rules and regulations to make a more vibrant market for folks to be able to purchase the coverage that they want. And then phase 3, which are the other bills, many of them insurance changes that will go through Congress, some of them concurrently, but some of them in the future.
So, Mr. Secretary, I just want to underline this because for a lot of families, this is a life and death question.
Well, sure it is.
If
that's why
Affordable
this
Care
is so
Act is
important.
repealed and this new House plan makes it through and is signed into law, gets through the Senate and everything else, there will be no gap. The people who are currently enjoying the benefits of the Affordable Care Act all will be covered by the new plan.
That's why the president said in his joint session to Congress a few weeks ago that we want to make certain that the transition timeline for this works for everybody. We want to make certain that nobody falls through the cracks, that the rug isn't pulled out from under anybody, that if somebody has a plan right now, they either are able to keep that plan or transition to a plan that, again, is much more responsive for them. Our goal is to keep patients at the focus of all of this. And sadly, where we find ourselves right now is a system where patients aren't at the focus of the health care financing and delivery system.
So the numbers like the 15 million people that have been thrown around that will be moved off of the Affordable Care Act are patently false.
I believe that those numbers look at this in a siloed situation where they don't look at the kind of reforms and changes that will come about or the options and greater choices that individuals will have. Again, we want nobody to lose coverage or lose access to coverage that currently has that, and we want to increase the number of individuals that have access to coverage. Remember, there are 20 million folks out there across this land who said to the previous administration and government, we don't want what you've got. We're either going to pay a penalty or we're going to request a waiver. 20 million folks don't have coverage right now because the federal government put in place rules and regulations that are too onerous for them to purchase coverage.
Mark Halperin.
Mr. Secretary, who is Keith Hall and what do you think of him?
Keith is the CBO director currently, and worked with him as budget chair in my previous job as chairman of the Budget Committee.
What do you think of him and his judgment?
Well, the Congressional Budget Office is an organization that does their doggonedest to get numbers right. But God bless them. The fact of the matter is that when they looked at Obamacare originally, the ACA originally, they said there would be over 20 million individuals who would be getting their coverage through the exchange. As you and I both know right now, that number of folks that are getting their coverage through the exchange that didn't have coverage before is in the 3, 4, 5 million range. So they've been woefully underperforming when it comes to evaluating health systems, and that's not because they're bad folks. It's because this is challenging stuff.
So why do we have this? I'm sorry to interrupt, Mr. Chair, but if you have so little faith in the CBO, even someone who you like and worked with and say has good judgment, why do we have the CBO? Why do we pay their salaries if you're just going to say we can disregard what they decide?
Well, it's a little off topic, but I'll put my budget hat back on and tell you that I put forward a whole series of recommendations for budget process reform. So, in fact, we could rely on the numbers that came from CBO. And I would urge my former colleagues to pick that up and move forward with it because it's absolutely necessary. The American people need to know, and members of Congress need to know, that they can trust the information that's coming from the Congressional Budget Office and from the Office of Management and Budget, which I believe will have different numbers as it relates to coverage and costs. And there are other individuals right now who are working on the legislation that is before Congress, looking at the legislation, and are going to come forward with their assessment and their modeling of what kind of coverage and cost numbers we'll see. But again, our goal is to keep patients at the center and make certain we have a system that's affordable for everybody, that's accessible for everybody, that's of the highest quality, and provides the kind of choices that the American people demand and deserve.
Congressman, just last question on this issue of people losing coverage. In your response, you said transition people either not lose coverage or not lose access to coverage. I want to ask you the same question I've asked other Republicans who are supporting this piece of legislation. Who are people consumers who will be worse off under your legislation than they are under the current law?
Well, it's a hypothetical, frankly. What we want are everybody to be better off. We want people to be able to purchase, again, the kind of coverage that they want for themselves and for their families. Right now, the American people, if they're buying through the exchange or if they have coverage supplied by their employer, they're being forced to purchase coverage that may or may not work for them. That's one of the important keys about why the ACA, Obamacare, we believe, has failed. That's because it's dictating to individuals what they've got to purchase.
You want everybody to be better off, but is there no category of person who you think would be worse off under the new law if it passed?
Well, the premise of that is that nobody's worse off right now. The fact of the matter is that there are millions of Americans who are worse off right now because of Obamacare and the ACA. I talked to my former medical colleagues. I'm a physician, a third physician to sit in this role as Secretary of Health and Human Services. I talked to my former medical colleagues, and they tell me that there are patients that come into their office, they make a recommendation for what they need to have, and the patient cries in their office because they say, I can't afford that because the deductibles under Obamacare have gone through the roof, and I can't afford the deductibles. So people may have an insurance card, but they aren't getting care. That's the key. We want folks to be able to get the care that they desire, not just the card.
Health and Human Services Secretary Tom Price, thank you very much for being on the show this morning.
Thanks so much. Have a great Friday, a great weekend.
Thank you.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.